Okay.
Yeah.
Eddie, can you please introduce yourself?
My name is Eddie Zaita, working in Sydney City Council. My age now 51. I'm working really a physical job. I had a problem in my lower back. I came to Dr. Edward Liski to explain to him that I have this problem from 2009. I came with no hope because I tried everything possible. Hopefully I'll be better.
So can you tell me about your problem? So what happened?
I had in my lower back, the doctor said it is disc number 4 or number 5, and they said it's ruining, and I felt this pain, and they told me you have to be injected with cortisone. And I heard that cortisone is not good for the body, and all the time I refused that. So I started to go to massage, acupuncture. I bought all the equipments in the market to relieve the pain, but all was temporary. And I remember one of my acupuncture doctors, his name is Emmanuel, he told me we're trying to make your body remember how it was repairing itself. And this was in my mind all the time. When I came to you, Dr. Edward, I found you told me the same word, which came straight away from my memory, that you said, we're trying to make your body repair itself. And the way to do that with ozone injection, which is a type of oxygen, but it is an element from, there is a machine to analyze them. In fact, in the beginning, I thought this magic, like I will get injection and that's it. But lucky that the doctor, your wife, really, God bless her, she took me and she took illumination, which the first time I hear about illumination. From the first time, I felt that my spine started to be straight, and I heard the cracks, and I asked, I feel energy now. And she told me, your hip was not in the place. Now we put everything in the place, but because this damage from 2009, we still need to go for treatment.
You're talking about alignment. Yes, we went through alignment. So tell me, how was your pain? Like in the beginning when you came, out of 10, how much pain did you have?
Every time I walk, my left leg, all the time from the back, where the end of my spine, pain, until I put my hand behind my back. And if I stand for a long time, the same problem.
So you had a pain in the leg as well, like a shooting pain in the legs.
Yeah.
That's why you had, it's called sciatica, so it's like another nerve pain which is going into the leg.
Yeah, until I felt this pain in my left tooth, in here, all the time, connected to down here.
So you have a nerve pain, and basically we've treated, and is it pain that was all the time?
Because I work physically, so this like regularly, so I can't even recognize the period I'll be alright, because I go home, I lay down on the floor, I take some exercise, and then I relieve, and then I go to work night shift again, and then I start again, and then again happens. So maybe I can say this was ruining my life, because we can say permanent problem.
Okay, and so what makes you come here? So you decide you were sick from having the pain. Why you decide to come here? What was the main reason?
I don't know, it was my lucky day. Really, without a compliment, I started to Google and look at the internet, and I tried to find any method, because I said there must be something we can't find. And then I found 2 methods. I found you can treat, there is a treatment with the bees sting, and I found the explanation that the bees goes to the infected areas and buy it you, and then I found your website, and then I found sound for your side is more reasonable or suitable for me, that we make the body prepare itself, we make the cells build what been damaged. So I came to you really, and I brought all my MRI, X-rays, everything. And the thing is, really, thank you very much for that. Before you see, you told me, okay, lay down, I can find this with my hand. And the thing make me believe in you straight away. While you touching, you said, yeah, you have a problem in the lower back. This can be wait for a while if you want. But there is another problem in your neck. And this was answer for a question I kept asking myself. Why I all the time in my left hand side feel numb, comes and goes. And then when you told me this, and you told me this is the one we need to start with. But in the end you told me it's up to you. And this consolidation is free. Take your time, you know. And I found I'm going, no obligation. Straight away I said, no, I have to start with my neck. And when I came and I done this illumination, and the ear cups was very nice too. It's really complete job.
So you had an alignment and the cupping.
And the cupping for two times. I felt really very good after that, and this encouraged me to start to do this injection.
Okay, and when we start the injection, how long it took you to notice the difference?
This what happened. In the beginning, I thought only to injection, especially after the lining and this ear cups. I felt I'm very good. So I said, maybe one or two, and I'll be alright. But I done 2 or 3, and then I had to go overseas. While I'm overseas, I start in the end of my holiday. I start to feel that there is some pain, but not like before. So as soon as I arrived, I came to you. You told me that this problem is not people different, not everyone the same. Some people were 2 times, some people 3 times, 4, maybe 8 times. But also in my circumstances, because I have to work and I still working physically, and you told me you have to have a rest, which I couldn't waste more annual leave, was difficult too. But you encourage me just only not to carry anything heavy, to look after myself while I move, and you keep patient with me. So now I can't count how many times I got injection, but maybe you can say 8. But every time the pain down. You told me one day you will come and you will tell me I have no pain. Now I'm here to tell you I have no pain. Thank you very much.
Okay, thank you so much.